Virus can often be treated at home, but if you're experiencing symptoms of COVID-19 and you've tested positive, listen up now for more on how to take care of yourself and your family. We're joined now by General Practitioner Dr. Matobela Majekane for a few tips on what it is that you should do. Doctor, thank you so much for joining us. A good morning to you. The recovery rate at this point has slipped to 89%. It really is quite concerning, and this leaves a lot of people worried. So let's start from the beginning, right? Your test comes back perhaps positive. What is it that you can do to start treating yourself immediately?
Thank you for having me, Naledi. Basically, what you can do to start treating yourself. The first and foremost thing is that you need to look at your symptoms. What is it that you're having? If you're having pain, if you're having sore throat, if you're coughing, what symptoms are you experiencing? So currently we are treating the symptoms that one is having. And it's very important that you monitor those symptoms while you are at home. And also we emphasize on taking immune boosters just to boost your immunity while you are at home. So those are the precautions that you can take.
Yeah, and then we've heard a lot of people say that they felt fine, and then just hours later, they're then in hospital on oxygen. So what are the warning signs that one needs to look out for? At what point do I need to present myself to a hospital?
The common warning signs are shortness of breath, chest pains, any difficulty in talking. The minute you find that you are struggling to talk, to conversate with people properly, you need to be checking yourself and finding out how you're doing. The other thing that is very, very important, there's an instrument called a pulse oximeter. If most people can invest in buying that, because when you have COVID and you buy a pulse oximeter, you can use it at home. It's going to measure the level of your oxygen saturation. And the minute your saturation level goes down to less than 92%, it's been shown that if you seek medical care, there's better outcome out of that.
Yeah. And I know that you've had COVID twice yourself, in the first wave, in the second wave as well. We're told that this wave and this variant very different to what we've seen previously. Perhaps some of the lessons that you've learned the first time around, the second time around, and then as you treat patients now, how it differs.
The first time around, I think most of the symptoms were mainly around your sensory issues, like people were not able to smell, to taste, body pains and aches. I found that the first wave and the second wave symptoms were more or less similar. However, with the third wave, we're finding that most of the patients are not necessarily coming in with the classic symptoms that we saw previously. People are coming in with joint pains. People are coming in with backache. There's a bit of a gastrointestinal symptoms, which were not that common in the first wave. And the spread of it is much faster than what we saw in the first and the second wave. So it's very, very important that we follow all the precautionary measures.
Yeah. It becomes a little bit difficult, though, when you are at home, you've tested positive, and you have family members that live with you as well. A few tips on how we deal with that, because not only is it frightening, but I imagine it's very frustrating to try and figure out areas to keep clean.
Yes, it is. I think it's still very important to go back to the basics of when somebody is infected, they need to be isolated or social distance, and make sure that they are regularly sanitizing their hands, and when they are coughing and sneezing, they're covering their mouth, and just to regularly check their temperatures, because usually they have a spike in temperature, as well as I mentioned, just to check their saturation level. Right. So how they'll protect each other is just to make sure that the one that is infected is not in close contact with the rest of the family members.
Yeah. Yeah, it's not an easy one. I think just maybe one last question, just so we feel that we have some sort of control. Maybe give us a list of important vitamins to have before you've had COVID, once you've had it, what it is that we need to have on our shopping list.
I think it's very important that we should just continuously be on some immune boosting medication. Vitamin C is very good because it's a high antioxidant tablet. You need to have vitamin D, zinc, any multivitamin combination that has all of those three that I've mentioned, and also vitamin D is going to help you and boost your immune system, as well as the IV drips that people are getting, because there is a far much better absorption in terms of the vitamins that we are introducing into your blood system.
Yeah. Well, that's some good advice, and I've certainly noted that list as well, Doc. Thank you so much for speaking to us. That there is Dr. Mathobela Majekane speaking to us. She's a general practitioner in the Western Cape.